Farida is a widower. She lost her husband and daughter in Afghanistan during the Civil War. She left with her son Rezaaq to make a new life in Australia. Rezaaq works as a gardener to support them. Farida tends to the house, making sure she prepares a good meal for when Rezaaq gets home. Farida enjoys good health. She gets exercise when she walks to the shops, and she visits friends when Rezaaq is at work. Her body is healthy, but Farida knows that it is just as important to be mentally and spiritually healthy too. So even when the most traumatic things have happened to her, she has always tried to stay positive. One afternoon, Farida is busy with her housework. Without thinking, she tries to move a heavy table to sweep behind it. Immediately, Farida feels strong pain in her lower back. The pain makes it very hard for her to walk, so she sits in a chair and waits for Rezaaq to come home. When Rezaaq arrives at 7 in the evening, he finds his mother in pain. He asks what's wrong, and she tells him what's happened. Rezaaq knows she needs medical attention. Because it is late, Rezaaq thinks about taking his mother to a hospital emergency department or phoning 000 so an ambulance will come. When his friend's father had a heart attack, his friend called 000, but Rezaaq knows it is not an emergency because his mother's life is not in danger. Rezaaq remembers a magnet on his fridge that has information about contacting a doctor when the clinics are normally closed. Following the information, he first phones his local GP clinic. The clinic is closed, but a recorded message gives him information about a local after-hours service. Rezaaq didn't know that GPs are available at night to treat less serious medical problems. He always thought that you had to go to a hospital.
Hello, doctor. My mother is...
When he calls the number, they tell him a doctor can visit his mother at home. He asks how much it will cost and is told the service can be bulk billed. This means if the patient has a Medicare card and healthcare card, the visit will be free.
Is the doctor here? Dr. Trevor. How are you going?
When the doctor arrives a few hours later, Rezaaq and Farida explain what the problem is.
My mom was suffering from the severe back pain. Yeah. Can you just try and straighten up a little bit? It hurts too much. And what about standing? Can you stand up?
Because the pain is strong, the doctor suggests that Farida takes some medication for the pain and sees a physiotherapist. A physiotherapist helps with physical pain and soreness in the bones and muscles, as well as helping to fix injuries. The doctor tells Rezaaq that there is a physiotherapist at the local community health centre and gives him a telephone number to make an appointment. The next day, Rezaaq phones to make the appointment. He knows that if he misses the appointment, he might have to rebook an appointment for another day.
Book an appointment for the physiotherapy for my mother.
Farida visits the community health centre for her appointment. Community health centres can offer a wide range of health services for people of all ages, such as physiotherapy, general practice, dental care and emotional health support. They check in at reception and soon the physiotherapist is ready to see Farida. After an assessment and some questions, the physiotherapist says Farida is okay to go home, but asks that she comes back in 2 weeks so they can check on her progress. Farida feels a little better after her visit. The physiotherapist says Farida should avoid heavy lifting for the next week and not to work for long periods of time without rest until she gets better.